Just as a quick reminder to everyone for connectivity so that we're able to hear, Jill, turn off your video, turn on your mute buttons, and sit back and take a moment for the National Overdose Response Service and virtual harm reduction portion of today's presentations.
Lisa, are you in here?
Yes, I am here, Jill. My camera's locked though.
That's okay. You want to start?
Okay. Do I want to start? Wow.
I don't want me. I don't know.
You go ahead.
All right. So we're the National Overdose Response Service. We offer mental health and substance use support virtually through an app service. And we have operators that are trained extensively with suicide prevention, de-escalation, LGBTQ plus, Indigenous areas, men's groups, women's groups, trafficking. We've had some interesting calls. I think we've reversed 157 overdoses since we opened. We haven't lost anybody on the line, so we've been pretty lucky. And so we are able to hire I think everybody here has lived or living experience. We don't ask for a criminal background check. We basically just, if you want to be here, then that's the kind of people that we want on the team. Most of us, I think all of us volunteered before we came on. It is a really, really great family. We use the band app for our check-ins and our rooms and all of the education pieces of it, and our virtual staff rooms. And there's just somebody always on 24/7. Right now, it is only available in Canada. But if they're the naloxone, if there are resources that we can add out too, I would like to talk about that at the end. We offer peer support certification through Grenfell Ministries. I want to take a second to talk about Becky. Rebecca started this out of a heroin addiction in prison and just wanted supports for people to be out there because there wasn't anything out here. So she started it with $1,000 charity donation, and it blew into a $2 million Health Canada project. It's been a ride for sure. And we've been very, very blessed to be working with some amazing service providers and just opening up all the resources that are out there and sharing and connecting. So Nora's, when we were able to keep going, and it's very close to home working for Nora's for a few of us. I think it started with 5 of us at the beginning, and now there's 166 people in the groups, and 30 staff and students stay on with us. We also do co-op placement students across Canada, and volunteers. We do hours for community service hours. They can come in and do them here. We have virtual support rooms for different areas of mental health, addictions, like safe rooms for people to break out into that are always monitored. One of us is always awake. There's usually a few of us in the chat. And we dispatch through Northern 911. We use them instead of calling direct because we are national. So it does get we do with police on the area, can't even train the police to be able to get out there and have harm reduction, so they don't have to be so just out of school when they get on site. We do a lot of events. Sorry, did I cut out?
Kind of got you. You kind of got gurgly there for a minute.
Oh, sorry.
No,
We do a lot of live events. We do Narcan training on site. I think we did like 480 at Summerfolk last year. And we've got some big events coming up this year. We do a t-shirt line for Stigma Sex. So that is one of them. I'm currently wearing Don't Eat the Tide Pod. I had Anxious AF on earlier. And they are all to build awareness around stigma. So there is the suicide line, prison yard, hopscotch champion, Yelp food score critic. 'Tis the season for sedatives was a good one. So we bring different swag out to events and just trying to get awareness out there for mental health and substance use. Nobody has to be alone. And that's the biggest thing over COVID. I think everybody was just so isolated. And even still now, breaking out of it, we've all been hiding behind cameras for so long. So thankfully, virtual has saved a lot of people over the last few years and just given them a safe space to be able to come without any judgment. And it's anonymous, and there's just somebody there to listen. Lisa?
Yeah, so Rebecca was my sister. We unfortunately lost her to an overdose last year, October 31st. So you'll see fucking Becky there. We're all sort of trying to pick up the pieces of this organization, and we probably say that many, many times a day. She had like 12 emails. Anyway, so I think it was started in because everything had closed down and the virtual consumption sites just weren't available to people. So it started as the Ontario Overdose Prevention Line. And then through a partnership with Brave and the wonderful Una and Monty out of the University of Alberta, we were able to get some funding through the Substance Users and Addictions Program, the SUOP program through Health Canada. So we got refunded, which was great to carry on another year. We were on a 2-year initial pilot program. And I think the pilot was set up to see whether whether this was just going to be going this virtual supervised consumption site during COVID, or whether it was going to be in use after COVID. And I think that was the big question. So we got another year to see how that was going to pan out. And as we're looking at and disseminating the stats on that, the usage of the line has actually increased, which is sort of interesting, even though physical CTSs are up and running again. There's some sort of other interesting things about NORS is that about 50% to 60% of our callers, depending on which month, are female, and 16% are gender diverse. Our lowest participants with the NORS line are actually males, which is a complete mirror image to a physical CTS site. So that's something that has kind of been interesting to see. I think we have a different demographic of users. I think because the anonymity of the service and, you know, just the physical safety of being able to remain in your home and sort of those things. We get some calls from, we get a lot of calls from healthcare practitioners. We've had some professional athletes calling in the line that are struggling with their relationships with opiate use. A lot of bankers, apparently a lot of bankers are doing a lot of coke, which is fine and good that they're calling the line. About 12% of our callers are Indigenous, which is good and sad. Anyway, so we can look at how when people are accessing our services. So 53% of our callers say that any SCS was currently closed, and about another 40% of our callers live in a city without an actual SCS. So I think we're seeing that NORS is a viable service even outside of the pandemic, because it's sort of filling different gaps that maybe physical SCSs aren't filling for people. So it's kind of interesting to look how it's unfolded. We're very, very grateful to have gotten another year of funding. You know, I've been listening in on this for a few hours now, and I think the takeaway here is we need to find ways to empower our communities, because our Western medical systems really aren't holding up their end of the bargain as far as I can tell. And I agree with all the other speakers in saying there's so much power in community. I know from doing NORS events that, you know, 99.9% of the general public is in total support of what we do and what we represent and what we stand for. So I think for NORS, as it's moving forward, and what our objectives are, is finding a ways to engage all the, now we're a national phone line. Canada is very, very big, so I'm not even sure how we're gonna start on that, but to engage communities to look after each other. So this year we're focusing on rural and Indigenous communities that our service actually doesn't work for. So for us to dispatch 911 to a community that's, 30 kilometers or 20 minutes away from any major center with EMS service, our service does not actually work for them. So we're reaching out to them to get some feedback on how we can best help. I think we're going to start doing community naloxone trainings virtually and trying to ship communities naloxone to these communities that just don't have access to it. So I think, empowering communities to take care of each other is going to yield far more humanitarian results than us trying to evolve and function in the sort of systemic crap that brought us here in the first place. So it's an interesting journey for sure. It's been an absolute honor to work with the people at NORS, with NORS, and in this industry. This was not my industry, but I ended up here by default. So I think if anybody has any questions about how we operate or how we work, or any questions, we could take some questions. Una? That's the best I can do on the fly.
You're doing great. You're doing great. I love it. Thank you so much. It's so good to see your face.
Oh, fuck.
J'adore.
We're doing it.
Yeah, and you too, Jill's. So good to see you. Yeah, there's lots of opportunity. We have a couple minutes where we can have some questions. There was a really interesting question. Do you think that stats are why you are bigger than Brave? And I was like, I love that so much. It was like the same reasons, like, do people prefer IM naloxone versus nasal naloxone? Is like, we need a continuum. Sorry, I'm answering this one. We need a continuum, and part of like the joy of the work that we do at Brave and with NORS and Never Use Alone and our other community partners is we know that all of our successes are like intertwined. So this is like such a great opportunity to, oh, that's the timer. That was your timer. I'll set that up. So you ended before the timer. So was there another couple of questions in there before we give some big love?
Yeah, I think there's power in numbers. If all of these agencies could join together and find a way to, disseminate the silos and fill each other's gaps, we could have huge success here, because I agree with everything everybody said. We are one thing as a human family. So, and our community, the community of people that we live in, truly believes that. I think they all really believe that and want to help. So maybe we just ditch Health Canada. I don't know, but they fund us, so can't do that. But I think as things progress, that's maybe what we're looking at. Although I will say they are funding us too. So on the flip side of that coin, it takes a very long time to turn a systemic big ship, but they are turning. They are turning, or we wouldn't be here. So they are our primary funders. So we have to give them credit for that. And they're good people that work there. They're people. It's systemic crap. I don't know what to say. We can't solve the problems of the world today, Una.
Well, we try, but Jill, I don't think you need to share your screen anymore. If you
No, I'm trying to get it off. This is my first time doing it, and I'm like, oh wow.
you are doing great.
Thank you.
Are doing
stop.
great.
There we go.
Oh
my
wow,
gosh,
I got so big on my screen.
All right, I'll take the spotlight off, y'all. Are there any more? Oh, hi.
I have one for everybody out there. So we get calls from US clients once in a while, and we do refer out to Never Use Alone. It would be great to have a little list of resources. Like, we don't get a lot, but to be able to refer out for stuff like that, or app services to be able to share across country. And do you guys get Canadian calls? Like, I'm sure it's got to happen. So is there a way that we can be on rosters to be referred out as well too?
Yeah, I think that's a great question. And I know that everyone's part of everyone else's resource list, but maybe someone from Never Use Alone could answer the Never Use Alone question. All right. So as far as I know, we build our resources in together. So we share. So one of the practices that we have is we have everybody's phone number on our hotline. We also have everybody's website and resources posted on almost all of our social media, as well as our website, as a way of what I like to call cross-pollinating, making that the fecund. Oh, hi, Stephen. All right, I want to see what Stephen's saying. Haven't had any Canadian callers on the Massachusetts line yet. But who knows, might happen one day. I do know that Never Use Alone does get Canadian callers, and that often they'll re-refer to NORS, or they'll just use the Northern 911, because it does access absolutely across North America. Any other questions?
Sorry, again, I had one from earlier, the naloxone certification over there. Does it count? Like, if we train our team, does the certificate carry over? Like, is that something that we could do on our website to share that contact?
Sure.
Yes.
100%. Excellent. Dana?
Let's do it.
I could see
We got a lot
Dana's, Dana's writing the notes.
Nice.
Amazing. Okay, so big round of emoji applause, hearts, love, whoop whoops for our NORS team, and so much heart for you coming today and holding it together. Bex would be proud. She'd be mad at you, but she'd also be proud.
He's so mad.
So mad.
I
But-
keep waiting to get struck down with lightning, but it hasn't happened yet. So I just keep trucking on. If you lose me, you know what happened.
Okay.
Anyway, thanks everybody for having us. I really appreciate it. And thank you for everybody here and the work that you do. We're stronger together, that's for sure. We're better to pay for care than we are for crisis, right? Let's woot.
Woot,
Thanks.
woot.